Ewing sarcoma is a rare and aggressive type of bone cancer that primarily affects children and young adults. It was first described by Dr. James Ewing in the early 20th century, hence the name. This cancer typically arises in the long bones, such as the arms and legs, as well as in the pelvis, chest wall, and spine. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Ewing sarcoma is characterized by the presence of specific genetic mutations involving the EWSR1 gene. Standard of care treatments for Ewing sarcoma. The treatment approach for Ewing sarcoma often involves a combination of therapies, which may include chemotherapy. Chemotherapy is a cornerstone of Ewing sarcoma treatment. Patients typically receive a multi-drug chemotherapy regimen to shrink the tumor before other treatments, such as surgery or radiation therapy, are considered. Surgery is often used to remove the primary tumor, especially if it's located in a limb or a surgically accessible area. In some cases, limb-sparing surgery can be performed to preserve function. Radiation therapy may be employed to target the tumor or surgical site to eliminate any remaining cancer cells. This is particularly useful for tumors that are difficult to remove surgically. Stem cell transplant. For some high-risk cases, a stem cell transplant, also known as a bone marrow transplant, may be considered to replace damaged bone marrow with healthy stem cells after high-dose chemotherapy. Prognosis for Ewing sarcoma. The prognosis for Ewing sarcoma varies depending on several factors, including the stage of the cancer, the location of the tumor, the age of the patient, and the response to treatment. Here are some general insights. Stage 1. Ewing sarcoma. In Stage 1, the cancer is localized and has not spread. With prompt and effective treatment, the prognosis for Stage 1. Ewing sarcoma can be relatively favorable, with long-term survival rates of approximately 70% to 80% or higher. Stage 4. Ewing sarcoma. Ewing sarcoma indicates that the cancer has metastasized, spread to distant sites, such as the lungs, bones, or bone marrow. Unfortunately, the prognosis for Stage 4 Ewing sarcoma is less favorable, with a lower 5-year survival rate often ranging from 15% to 30%. It's crucial to remember that these are general statistics and that individual outcomes can vary. Advances in treatment, including targeted therapies and immunotherapies, have the potential to improve prognosis and long-term survival for Ewing sarcoma patients. The dedication of healthcare providers and ongoing research efforts are critical in advancing treatment options and outcomes for those affected by this cancer. Promising therapeutics for Ewing sarcoma. Research into Ewing sarcoma is ongoing, and several promising therapeutics are being investigated. These include targeted therapies. Researchers are exploring targeted therapies that specifically target the genetic abnormalities found in Ewing sarcoma cells. These therapies aim to disrupt the cancer's growth pathways more effectively while minimizing damage to healthy cells. Immunotherapies, such as immune checkpoint inhibitors and chimeric antigen receptor (CAR) T-cell therapies, are being studied in clinical trials for Ewing sarcoma. These treatments harness the body's immune system to target and destroy cancer cells. Precision medicine. Precision medicine approaches involve tailoring treatment plans based on an individual's unique genetic profile. This allows for more personalized and effective therapies. One website to research clinical trials for Ewing sarcoma is onclive.com. A variety of promising integrative treatments against Ewing sarcoma are described in Cancer Self-Defense 101 – Quick Tips to help you survive. Challenges in treating Ewing sarcoma. Ewing sarcoma presents several challenges, contributing to its status as a tricky cancer. Aggressive nature. Ewing sarcoma is highly aggressive and can grow rapidly, making early detection and treatment critical. Young patient population. Ewing sarcoma primarily affects children and young adults, adding emotional and developmental challenges to treatment. Metastatic potential. The cancer has a propensity to metastasize, often to the lungs or bones, even when diagnosed at an early stage. Limited treatment options. While advances have been made, treatment options are still limited, and many patients require intense therapy regimens. Risk factors for developing Ewing sarcoma. The exact cause of Ewing sarcoma remains unknown, and there are no well-established risk factors for developing this cancer. It is not typically associated with lifestyle factors, and most cases occur sporadically. However, some genetic factors and chromosomal abnormalities may contribute to its development. Organizations and resources for Ewing sarcoma. Several organizations and resources are dedicated to supporting individuals with Ewing sarcoma and their families, as well as funding research efforts. Some notable organizations include the Ewing Sarcoma Foundation, provides information, resources, and support for patients and families affected by Ewing sarcoma. They also fund research into better treatments. St. Jude Children's Research Hospital conducts research and provides comprehensive care for pediatric cancer patients, including those with Ewing sarcoma. Cancer Support Community offers support and resources for cancer patients and their families, including online and in-person support groups. It's important for individuals diagnosed with Ewing sarcoma to connect with healthcare providers and these organizations to access the latest information, treatments, and support networks. Additionally, participation in clinical trials may offer access to cutting-edge therapies and contribute to advancing the understanding and treatment of this cancer. For more information, please see Cancer Self-Defense 101, Quick Tips to Help You Survive.